Chris from WHO. Can you please give me, in a bit more detail, we heard David speaking about it earlier, the health equity perspective, please. Over to you.
Thanks very much for that, Alice. Great to be with everyone today. I mean, just to start off with, I heard the discussion earlier around how do we get politicians to take notice? Well, there's lots of different ways, but you might be interested to know that 84% of the public believe that inequalities should be top of their government's agenda. So the public are already saying that. This is a review of public opinion polls prior to COVID. We believe it hasn't changed. And there's another way. We need to get on our feet, and the public are doing that. So yes, we know that there are anti-vaccination restriction demonstrations on the streets, but please let's not miss that in fact the people on the streets in our cities are on the streets complaining and worried and demanding that the government looks after them, secures their livelihood, their ability to have shelter, their ability to afford food and to have warm homes. This is also what's going on. So let's not let the vaccine dissenters overshadow why people are on the streets today. And really, all I can say is that no more than any time in the recent past, unprecedented understanding amongst the public, amongst the government, international community, that health and well-being, resilience and sustainability are critical to our societies and economy. That means they are not just values, they are actual assets and capitals, and we need to start seeing them as such. This was demonstrated at the height of COVID, and I think when we look now at recovery, we need to think about the right kind of policies and systems for recovery. So I just want to recap. So unless we have a clear idea about what our starting point is and why COVID has really put inequalities and equity at the heart of the agenda, we need to show that prior to COVID, 20%, the reasons why people were falling behind in terms of life and health could be explained by our health equity status report, the first ever European health equity status report on equity in Europe. And 83% of inequities in mental health between the top and the bottom income and education groups, and in well-being, such as self-perceived health and limiting illness, were due to 5 conditions. That's insecure homes, underdeveloped fractured communities, and poverty. And by that we mean not being able to make ends meet, despite that we're working 2 and 3 jobs in a month. Health services were underprepared and under-resourced, and we know that 10% of inequities are due to lack of need for healthcare being met. We know that 20% of the reason why those who are falling behind in health and life fail to be able to engage and catch up are to do with lack of human and social capital, and that's lack of agency, lack of trust, lack of social support, and living in environment perceived or actual threat and violence. And of course, you know, none of this is surprising, but countries have prioritized GDP for many years over everything at the center of all decision making, and particularly those who are left behind. And that means moving from market-dominated decisions to an economy of well-being, which puts social priorities such as trust, security, and I mean, yes, security from virus, but security to live free from violence, to live with a roof over our head, to be able to feed ourselves and our children. This is what I'm talking about, these essential conditions. These are the social priorities, and those that are around trust. So if you allow me just a couple more minutes to pick up on some few points there. What that really means is we need to move away from talking about inequalities and the problem and numbers, because we talk about inequalities as a problem. It is, but we need to make the invisible visible, and we need to talk about the real lives of those people that we're talking about who are left behind. So to be able to do that, we need to better understand the lived experience, and we need to develop a new body of knowledge and evidence that will enable us to better understand the realities of the lives of those being left behind, because our evidence today is based on some hypothetical average person, which means that even well designed and intended policies are actually not delivering equitable impact. So we know that when we use evidence such as community-based, assets-based models, place-based approaches, when we use community bloggers, such as in the Other Frontline initiative, such as No One Left Outside is using and have been working with WHO, we get much better designed policies, but we get something else. We get higher trust between the public and decision makers, and recognizing here that the public are decision makers and we need to give those left behind a voice in that process. So one of the tools that WHO has developed is the Behavioural Insights Survey tool, and more than 30 countries are using this tool to better inform, engage with communities, NGOs, to better understand the reality of life and devise pandemic preparedness and response plans, but also to design and inform economic recovery and resilience policies. I think that's the first point I'd like to say. I think the second thing I would like to say is that there is now a convergence of different stakeholders that inequalities is a major problem, but there's massive divergence on the solutions. And what that actually means is that equity can get crowded out, and the voices of those left behind can get crowded out in rebuilding, in solutions generation. So what that really needs is new forms of focusing not just on problems, on solutions, but on participatory policy making and governance. And let me give you an example. Mental health represents a really vital element of individual and collective well-being globally and here in Europe. And we need to acknowledge that, particularly for the 18 to 28-year-olds, they're at high risk of developing poor mental health due to higher unemployment, non-decent work and income insecurity. Now, those in the bottom 20% income groups of young people have had their mental health more severely impacted during COVID, with twofold increase in risk of social exclusion, poverty, poor mental health among 18 to 28-year-olds who are in the bottom 20% income and education groups. And we know that there's a gender difference in this in terms of depression and suicide. So all sectors are recognizing that young people, their mental health, social inclusion is important for recovery, healthy recovery, economic recovery. But how do we do that in a way that the voice of the 20% being left behind is heard, and that those solutions and policies address and level up the gap? We're doing that through convening stakeholders and young people around the solution space, understanding the barriers, understanding and talking to young people about what is needed to build more inclusive economies for them, better working conditions for them, more accessible health services, preventive health services, and using that dialogue to convene stakeholders to hear and listen to young people, and using that to design policies. A second example is the Mental Health Coalition. And this will be my final point. I know I might have more time to come back. But what we're seeing for equity is that no one stakeholder, no one sector can and has the solutions in their hand. So we have to move forward through coalitions. And just 2 months ago, the Queen of Belgium hosted the launch of the Pan-European Mental Health Coalition. And I can see that we have Claudia from Mental Health Europe around the table, who is a member of that. Well, along with Mental Health Europe, we have memberships of stakeholders from government, non-government partners, professional associations, employers, development agencies, and young people. And the idea is to develop multi-sectoral plans to address the mental health needs with and for young people and children in the European region, to prevent self-harm, suicides, improve mental literacy, but ensure that those essential conditions, shelter, income, security, freedom from discrimination and violence are looked at in an integrated way. And we know that from the evidence that the impact is good for mental health, it's good for human capital, it's good for sustainable recovery. And here's where we get the co-benefits. So I think I'm going to stop there.
Thank you very much, Chris. Lots of meat in there. Wow, goodness me. And lots of meat for our discussion afterwards. You're quite right. Keep some up your sleeve, please.